Namaste and greetings from Nano hospitals. Today we will discuss about back pain. Causes of back pain. What are the common causes of back pain? How you can prevent them? How you can treat them at home? When do you need to see a doctor? Commonest causes of back pain are trauma, age-related, which is degeneration, infective, inflammatory conditions, and other neoplastic conditions. For the simplicity, we'll just go through few of the common causes. One is trauma. Trauma you can divide majorly into low intensity injuries and high intensity injuries. High intensity injuries, of course, it can cause physical injury to the structures of the spine, which are the bones, the ligaments, or the spinal cord. Each have its own consequence. But the commonest, rather than the high intensity trauma, it is the low intensity traumas which generally happen in our day-to-day activities, like getting in or out of the car, bending and picking some heavy objects, sudden jerky movements, small twist and small fall. So these low intensity injuries also causes injuries, pain, but may not be structural injuries to any of the anatomical structures. These causes something called a spasm. Spasm is basically a protective mechanism of the muscles of the spine to prevent further injury. They go in for a spasm. Normally muscle contracts and relaxes, but they remain in a state of contraction which is painful. This stops further injury to the further more important structures within the spinal canal, which is the nerves on the spinal cord. So this is the commonest cause for most of the OPD visits which we see or clinics every day. And the other one would be inflammatory causes. Before the inflammatory causes, I would like to about the degenerative causes, which are the age-related processes where is wear and tear in all the spinal joints and the discs. Brief introduction, I will just like to show you the structure of this spine, where you have vertebra, the bones, in between these which are stacked one above the other. In between there is a cushion-like structure called the disc, which will aid in the movement and the axial compression of the spine. Which occurs in day-to-day activities. And then there are spinal canal, from where the nerves from our brain are situated and exit at each level, which will supply different parts of our body, right from the head to the toe. They are in a very precarious position, wherein they lie very close to the discs. Anything injury to these discs can cause compression of the nerve very easily, which is the most other commonest cause which we see in back pain, which is the disc problems. It can be of various degrees, again just a bulge, protrusion or extrusion, which will cause basically a degree, the severity of the disc prolapse. So whenever there is an irritation of the nerve exiting through the spinal canal or the spinal neural foramen, along that nerve, which is what the part of the body which is supplied with that nerve, will get pain, or sometimes it might be a weakness in the muscle supplied by those nerves. So another cause would be inflammatory causes, which is most likely due to autoimmune diseases like we call it as spondyloarthritis, which has to be evaluated. Basically, which happens not because of any external factors but internal factors, where our immune cells act against our own body cells, causing inflammation in the spinal joints, which are not so common, but then we encounter now and then.